Hello everyone, I am James Andre C. Corba from BSN 111I, a student nurse from Davao Doctors College. And in this video, I'll be performing my return demonstration and assessing the thorax and the lungs. But first, review the client's previous medical records and doctor's order sheets if available. And then, determine the scope of assessment needed. Prepare the necessary equipment to save time and energy. This includes a ball pen, marker, 8-inch ruler, and of course, a stethoscope. And then, perform hand hygiene to deter the spread of microorganisms or do gloves if necessary. This is to prevent the spread of microorganisms. And then, greet the client politely and the client's companion if around. Introduce self and verify client's identity as how the client to be called during the assessment, and establish rapport with the client. Hello sir, good morning. I am James Andre, your student nurse for today. Before anything else sir, can you please tell me your basic information please? Your name?
Cyril Baba,
Your birthday please?
March 25.
Okay, thank you. What do you want me to call you, sir?
You can just simply call me Cyril.
Okay. For now, Mr. Cyril, I will be doing assessment in your thorax and lungs. Is that okay with you?
Yes, it is okay.
Okay. And, but before anything else, sir, how are you?
I'm okay, but in the past few days, I have been experiencing cough, cold, and headache and scratchy throat.
Okay. Explain the procedure to the client and how he can participate during the assessment, and provide the client to ask, raise, or any concerns. And then ensure the client's comfort, privacy, and confidentiality, and make sure that the assessment setting was assured to be safe, secured, and free from distractions. Then position the client to be seated comfortably and in woman, drape the anterior thorax when it is not being examined. So now sir, since I close the doors, so I will now close the curtains, okay?
Okay.
So, before anything else, sir, do you have any questions or clarifications before you proceed?
None so far.
Okay, sir, thank you. So now, can you please take off your shirt? Okay, thank you. So first is to check for the signs of respiratory distress, like nasal flaring, pursed lips, breathing, and retractions or problems with oxygenation, and observe the color of the face, lips, chest, and fingernails. Palpate the suprasternal notch and noted the position of the trachea. And now, sir, I will inspect your face. Okay, is that okay with you?
Yes, it is okay.
Can you please look to your left side and to your right side, please? Okay. Your fingernails, please. Okay, thank you. Now we will inspect for configuration. So while the client is standing, the arms should be at the sides, and you should be standing behind the client and observe the position of the scapulae and the shape and configuration of the chest wall. So now, sir, can you please stand up and face the wall as I observe your back? Okay, thank you. Next, we will inspect the spinal alignment for deformities. So from the lateral position, now observe the three normal curvatures, the cervical, thoracic, and the lumbar. And now to assess for lateral deviation of the spine scoliosis, observe the standing client from the rear. And now have the client bend forward at the waist and observe from behind. Now, sir, can you please bend for me? Okay. Thank you. Now we will now palpate the posterior thorax. Assess the temperature and the integrity of all chest skin. Palpate all the thorax areas of bulges, tenderness, or any abnormal movements. So now, sir, can you please take your seat? Now, sir, I will check your skin, okay?
Okay.
So, by checking the skin, I will use the back of my hands or the dorsal because this is the most sensitive of our hand. Okay, thank you. Then we will now proceed to the palpating the posterior thorax for the respiratory excursion. And place the palms of both of your hands over the lower thorax with your thumbs adjacent to the spine and your fingers stretched laterally. Then ask the client to take deep breath while you observe the movement of your hands and any log-in movement. Now, sir, I will touch your skin or back again, okay?
Okay.
Can you please inhale, deep breath, breathly. Again. Okay, thank you. So, in palpating the thorax and vocal fremitus, place the palmar surface of your fingertips or the ulnar aspect of your hand or closed fist on the posterior thorax, starting near the apex of the lungs. Ask the client to repeat such words as such words just like blue moon or 1, 2, 3. Okay. Now, sir, can you please cross your arm for me?
Okay.
And bow down your head. Can you say the word 1, 2, 3?
1, 2, 3.
Again, please.
1, 2, 3.
Again, please.
1, 2, 3.
Okay, thank you. Now, repeat the 2 steps, then move your hands sequentially to the base of the lungs. Start toward the midline at the level of the left scapula over the apex of the lung. And then move your hand of the left scapula over the findings bilaterally. Move symmetrically downward and out to cover the lateral portions of the lungs at the bases. Compare the fremitus on both lungs and between the apex at the base of each lung, using either one hand or moving it from one side to the client to the corresponding area on the other side, or using 2 hands that are placed simultaneously on the corresponding areas of each side of the thorax. Now, sir, I will repeat the procedure, okay? Can you please cross your hand again and bow down your head? Can you say it 1, 2, 3?
1, 2, 3.
Again,
1,
please.
2, 3. 1, 2, 3.
Okay, thank you. Next is percuss the posterior thorax. Ask the client to bend the head and fold the arms forward across the chest. Percuss the intercostal spaces about 5 cm or 2 inches intervals in systematic sequence, then compare to one side of the lung with the other. Percuss the lateral thorax every few inches, starting the axilla and working down to the 8th rib. Now, sir, can you please cross your arm and bow down your head as I percuss your back, okay?
Okay.
Okay, thank you. And then measure the diaphragmatic excursion. Use percussion to identify the level of the diaphragm and measure diaphragmatic excursion. Percuss downwards from above the expected level of the diaphragmatic dullness until dullness is definitely heard. After gaining the patient's permission for mark the level of full expiration. Ask the client to inhale deeply and hold it in, then percuss downward to the level of dullness and full inspiration and mark it. Repeat this process on the other side. Can you please inhale? Again. Again, please. Can you please deep inhale? Okay, thank you. On the other side, please. Can you please inhale? Again, please. Inhale. Again, please. Inhale. Okay, thank you. Now I will measure. Okay, sir. And then record the assessment that you do. And after that is percause the posterior. And after that is auscultated for the breath sound. Place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung, so as the client to breathe deeply through the mouth of each area of auscultation. Then, using the systematic ladder pattern, use the percussion. Listen at each point of the breath sound during the complete inspiration and expiration. Then compare the findings at each point with the corresponding point of the opposite side of the thorax. Also note that the location of the chest wall where the adventitious or adventitious sounds are heard, as well as the location of such sound. Now, sir, I will check your breath. Okay? Can you please inhale? Again, please. Again. 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 Okay, thank you. Now, for the bronchopony, ask the client to repeat the phrase 99 while auscultating the chest wall. Now, sir, I will do it again, but in this time, you will say the word 99, okay?
Okay.
Can you please say the word 99?
99.
Again?
99. 99. 99. 99. 99. 99. 99.
Okay, thank you. And then for digophony, ask the client to repeat the letter E while listening over the chest wall. Now, sir, at this time, you will say the letter E, okay?
Okay. E. 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 Okay, thank you. Lastly, for the whispered terminology, ask the client to whisper the phrase 1, 2, 3 while auscultating at the chest wall. Now, sir, in this time, you will whisper the word 1, 2, 3, okay? Okay.
Now,
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
okay, thank you. Next is assessing the anterior thorax. Inspect for breathing patterns. Inspect the costal angle formed by the intersection of the costal margins, and angle at which the ribs enter the spine. And then palpate the anterior thorax for tenderness, sensation, surface masses, crepitus, firmitus, or etc. So,
In this procedure, I will use my fingers to palpate the tenderness and sensation. Start palpating with my hand position over the left clavicle, over the apex of the left lung. And I will move my hand to the left or to the right, comparing findings bilaterally. Then, move my hand systematically downward toward the midline at the level of the breast, and outward at base to include the lateral aspect of the lung. Then, repeat the sequence in palpating the crepitus and fremitus anterior. And then ask the client to lay down on the bed. So now, Sir Cyril, can you please lay down on the bed? So the patient is now laying on the bed. We will now properly proceed to the procedure. Next is assessing the palpated the anterior thorax for the respiratory excursion. So I will place the palms of both of my hands on the lower thorax. So with my fingers laterally along the lower rib cage and the thumbs along the costal margins. And then ask the client to take deep breath while you observe the movement of your hands. Now, sir, can you please inhale deeply? Okay, thank you. Next is percuss the anterior thorax systematically. First is to begin percussing above the clavicle to the supraclavicular space and proceed downward to the diaphragm. Then compare the lung on one side to the lung on the other side. Then they place the female breast to facilitate percussions of the lungs. Next is auscultated for anterior breath sounds and voice sounds. Then auscultated the trachea and auscultating the thorax. First is to place the diaphragm on the stethoscope, feel me indirectly on the anterior chest wall. Then auscultated from the of the lungs slightly above the clavicles to the bases of the lungs at the sixth rib. Follow the sequence of the anterior chest auscultation. So now ask the client to breathe deeply through the mouth in an effort to avoid transmissions of the sound. And then listen at each side for at least one complete respiratory cycle. So now, sir, can you inhale deeply? Normally, rather. Inhale deeply. Okay, thank you. Now we will, sir, we are done in assessing. You can now take your seat and wear your shirt. For the summary and closing phase, summarize the informations obtained during the working phase and discuss the findings with the client. So hello, sir. Now I am going to read your findings during the assessment. So during the surveying the chest and respiration, there is a small problem with your respiratory distress and oxygenation. And also, sir, during the palpation, there is no any abnormalities, which is good. So also during the percussion, there was dullness over the area of the upper respiratory. And also listening to your breathing sound, I heard that there is cracking or coarse rumbling in the lungs. So sir, adding up to your complaints earlier, which were cold, cough, scratchy throat, or headache, you might need further examinations, and you should go to your physician and set a schedule. So with that, sir, do you have any questions or clarifications before we end?
I don't have any clarification at all.
Okay, sir. With that, sir, thank you for your 100% cooperation. Thank you for participating in this assessment. And thank you and have a nice day. And then, discuss the client possible plans to resolve the health concerns if present, assess the client's understanding of the plan, and need for further teaching. Provide the client opportunity to clarify as or any concerns. Thank the client politely, and after caring, perform hand hygiene to deter the spread of microorganisms. And after that, document the findings in the client record using printed or electronic forms or checklists. And after that, I will now perform the hand hygiene to deter the spread of microorganisms.